So my name is Tanya Beck, and I'm the founder for Coastal Fitness and Correction. And we are
Yeah, you
cancer exercise specialists. And we focus on each client as an individual, and we focus on their program design based on their specifics as far as the type of cancer that they have, the surgeries that they've gone through, the treatments that they're currently undergoing, uh, medication wise. And based on that and many other factors, we design an exercise program for them. So uh, a cancer exercise specialist is basically a advanced qualification for personal trainers and healthcare professionals out there. So I just want to touch a little bit about um, the benefits of exercise. So the individualized programming is big. So again, for the individual, based on the type of cancer, type of surgeries, medications, comorbidities, meaning heart disease, diabetes, or orthopedic disorders or injuries. They might have past injuries that limit range of motion doing other exercises. They might have disorders like kyphosis, which is the rounding of the upper back. They might have lordosis, which is the arching of the lower back. The safety of the individualized programming is such we have a controlled environment. So everything stays super clean. So it's not like a gym that you would go into and everybody else is wiping down their machines. We actually control all of that and making sure that everything does get cleaned. We also offer virtual options for folks that are immunosuppressed that can't be out and about. So they're able to still work out virtually and get the benefits. We're able to give constant monitoring of form and the physicalities of the levels on a day-to-day basis. So that way we track everything. We can see if there is a start to see a regression in form, then we know that things might be a little too intense or that you know, we might need to adjust the programming just a bit. And then client education is very big on making sure that they understand what proper form is before you start putting on any type of weight. The health benefits for exercise at diagnosis and throughout survivorship is this: it reduces the anxiety, the depression, the pain, the fatigue that comes with treatments, the injury risk, and it reduces the cancer reoccurrence. So it also promotes improved muscle retention with little to no muscle wasting. And some of the treatments that are out there, um, you know, we have to work against in order to keep the muscle and to keep everybody strong. It also promotes treatment tolerance, strength and endurance, energy and coping, mobility and balance, posture, range of motion, sleep quality, and the overall function of your daily life activities. So really, I was kind of going through that pretty quickly because this is really what I want to talk to everyone about today. And going back to client education, this is one of the things that we are very passionate about because it is a very real thing. And we want to make sure that everyone is educated as in what lymphedema is, what you can do to prevent it, and what the signs of the stages are. So we're going to go through all of that today. So what is lymphedema? Lymphedema is lymph fluid that does not properly flow through the lymphatic system, and it begins to accumulate in the tissue under the skin. So this causes painful and inflammation around, and limited range of motion can happen. It can be chronic and progressive that continues to worsen over time if not treated. So early detection is key.
Tanya,
Who
will
is at
you
risk?
press the from current slide up in the top? It'll fill the whole screen. I think some of the font, just the
one
from
here?
current. No, the next. Well, you'll just have to scroll down to your next slide. Just hit the arrow or scroll down
Okay,
and
I
click,
got
and
it.
it'll go to it.
Perfect.
There you go. Is that better? Do you want me to go back through? Okay. So who is at risk? All cancer survivors who have had lymph nodes surgically removed or damaged by radiation. And it can occur immediately after surgery. It can occur weeks after, even years, 15, 20 years. And it usually, it occurs in the area closest to where the lymph nodes were removed. So in this case, it would generally be the arm, a little bit of the chest and shoulder. So how do you prevent or manage lymphedema? So these are my top 8 ways of doing it. Number 1, avoid tight-fitting jewelry or clothing that has tight elastic bands on the affected limb that could impair circulation. You want to avoid overheating the body. So like saunas, steam rooms, hot tubs, things that are really going to raise that inner body temperature. You want to keep the at-risk area meticulously clean and use lotion after showering. You want to avoid nicks, cuts, scrapes, bug bites, etc. On that affected area. And even if some of you shave your underarms, you would want to use an electric shaver instead. And you want to treat skin breaks and infections immediately with soap and water, and follow it up with an antibacterial ointment. So that's really important because with having those lymph nodes removed, you are at greater risk for infection, even from a paper cut. So you just want to make sure that you're taking care of the area as best you can. When you're traveling, you want to think about maybe elevating the arm or wear a compression sleeve. Lymphatic massage, I highly recommend it. And if you're already working out or you're going back to working out, don't progress your strength or endurance exercise too quickly. Even my athletes, they have to be taking all the way down to almost a beginner level and then increased from there, because even a seasoned lifter can lift a little too much and engage that whole lymph system and create swelling. So that's the whole thing. We're just trying to avoid the swelling. So it's not like you won't be able to get back to doing strength and endurance, but you just want to progress it slowly. And then do your lymphatic drainage exercises every morning and or before you exercise. And we're going to go through those. Lastly, you want to know the stages. Okay, know the stages of the lymphedema, because early detection is key. And if you start to detect that swelling, then make sure you see a medical professional to prevent the progression. So, and the bonus is for you is that exercise can enhance the lymphatic flow. So another benefit to exercise during. So stages of lymphedema. Stage 0, there are actually 4 stages. I'm listing 3. Stage 0, it kind of progresses slowly. You might even come out of surgery or radiation with um, uh, a mild stage of actually stage 0. So it progresses slowly. You might feel sensations of tightness, heaviness, or even tingling. So the tightness might feel like you have a book underneath your arm, but there's no visible swelling yet. You might feel it, but not visible yet. They need actually special imaging equipment to diagnose that. The tingling, it can actually feel like an ice cube even being taken down the back side of the arm here. So any of those things are a sign that you might be in stage 0. So just have your medical professional check. Better to be safe. Stage 1, the swelling may or may not be present all the time. It can be intermittent. So it might get better and then you rest it a little bit and then the swelling goes away. The skin, when you press on it, will pit when swelling is present and it'll hold the indentation. And then elevating the limb when this is happening is very helpful. So it'll help that kind of drain through. Stage 2, swelling does not go away even with the elevation. Tissue is firmer, but it shows less sign of pitting. Fibrosis occurs, which is scarring of the tissue due to prolonged stagnant lymph fluid. And the skin starts to feel a little hard. So past this point is stage 3, which is really terrible to talk about. You can Google what stage 3 is, but seriously, if you can stay on top of 0, 1, and 2, we don't ever have to get to a stage 3. So your lymphatic exercises are this, and truly, we're just really thinking about the upper body because if you've had a lumpectomy or a mastectomy where you've had lymph nodes removed, this really is only pertaining to that upper body portion. So I will have a digital copy of these exercises. I believe Peggy already has them, but they'll be available to you. You just have to email and request it. But it's so simple. And this can be the difference between getting lymphedema or not. So doing these lymphatic drainage exercises are key, and it really starts with breathing. It starts with breath work. It starts with doing a gentle pelvic tilt, then followed by crunches, gentle neck stretches, shrugs, shoulder rolls, shoulder blade squeezing, isometric chest presses, shoulder circles, wrist circles, wrist flexion and extension, and then lastly, the fist clenching. So you would only do the lower body if you had issues on that end, but really just doing these, do them as your warm up, do them as your, you wake up in the morning, you get out of the shower, you do your exercises. Before you get ready to work out, do your exercises. Make this a part of your workout routine. And I think that should be pretty much it. So if you have any questions, I am more than happy to ask. If not, you can always reach me by email on the previous screen, and I'm more than happy and available to speak with anyone.
Yes, we've shared your stuff so much, and I know the guys have read and watched your video from last month, so it's so excellent information and all. A lot of them
I
said they've already
appreciate that.
getting started to using it. So it's
Great.
very, very good. So we can't thank you enough on all the details and information here.
Yes, ma'am.
Definitely. Brett, did you do your exercises when you had it? I'm asking you.
Me, I mean, I didn't have any lymphedema.
Here,
So
you unmute. Unmute. Yeah.
I didn't have any lymphedema, but thankfully. But I know that sharing this information, because Ron, I know has been going through it a lot lately, and just there are other men in our group that have it, and then anybody that's recently diagnosed, any ways that they can prevent it from coming about. So this information is very helpful. Not going through it, I don't have too many questions to ask and everything. I guess it's just hearing from you and then Dr. J Harness about exercise oncology and stuff. It's just that encouragement that stay active and do just like some of these little exercises and activities throughout the week and everything to keep you be more proactive than reactive.
So, Brett, one thing that I do want to say and make clear is that the exercises are actually about prevention. So that way to keep people that have had lymph nodes removed or damaged from getting to that point. So where they start seeing those signs of lymphedema. So yeah, this is just like a precursor to their workouts.
Copy. Thank you.
That's excellent knowledge, I tell you. So it's something they should keep up no matter what, right?
Yes, ma'am. They should.
Excellent.
Just safe practices.
Absolutely. All right. Does anybody else have any questions or want? If
Peggy,
yes, go ahead, Sherry.
I have a question. I'm sorry,
Yes,
I'm
ma'am.
driving, so if it's noisy, forgive me. So I would like to know if I can freely share this incredible information on our platform, and if the answer is yes, I'd like to know how. What is it, like, not proprietary or something that I can freely share? The other question I have is, have you done any extra research on, I'm going to say rebounding, but I don't want you thinking people jumping up to the ceiling and jumping down, but just a small aggravation of negative G's. The NASA did a fabulous study on lymphatic cleansing through rebounding, we'll call it that. I just wanted to know if you've had any time to look into rebounding. So I'm going to turn it off and listen. And again, I'm sorry if it's very loud, guys. It's beautiful, amazing information. I'm really excited to share if I'm allowed to. Thank you.
Those are great questions. And I freely, yes, this information is so important that I want everybody to have it. So as many people as we can share it, we need to share it and give it to them. So
I'll connect you all by email so you guys can do it. Okay.
Oh, okay. That's perfect.
Yeah.
And then to answer your question about the rebounding, I love that you asked that question because actually we don't actually use a rebounder. Some places may, but you can also do a Bosu ball, which is a half ball. It's like flat on one side and it's like half of a stability ball on the other. And you can hold on to the kitchen counter and put that ball down and just, you're kind of rebounding, but you're not lifting your feet up, but it gives you the same sensation. And yes, as a matter of fact, I encourage my clients to start with that and then do their lymphatic massage as part of their warm-ups.
That's awesome. Thank you very much.
Yeah, and Sherry, she's willing to get on a Zoom call with your clients too, that that you ever need to do. She did a wonderful, it's on our YouTube channel. She did it and her brother's page of last month's call of her explaining all this, which is amazing. and sharing it out. And like I said, it's been viewed many, many times. And I'll definitely connect the two of you to see how you can develop it more for what you're doing.
Yeah,
would be
and
great.
has Ron connected?
Yes.
Because
yes.
he has. Okay, so he's done a podcast?
Not yet. He's going to. He's going to get her scheduled after the first of the year to do a
Excellent.
podcast for her.
Perfect. Thank you.
Thank you for everything, Miss Sherry.
Appreciate your question.